switching gears here. We want to talk about these words that are being thrown around, these PEP and PREP. And for those who don't know, those are two forms of prophylaxis. And the most famous, most typical form of prophylaxis is condoms. And these are, in certain sense, not alternatives to, but different types of prophylaxis. So can you describe PrEP and PEP?
Yeah, so PrEP stands for pre-exposure prophylaxis. In other words, if you are sexually active and you don't want to use a condom, but you want to prevent yourself from becoming infected with HIV, there are one of two different modes, theoretical modes, for which we might be able to prevent that exposure. And one might be, firstly, taking medication, like antivirals or a combination of antivirals. So if one gets exposed to HIV, the medications are already on board, and they can halt HIV replication or prevent it from getting a hold in the body. And the second possibility of pre-exposure prophylaxis is spermicide.
Which we're very excited about.
Which there's been some studies looking at vaginal spermicides and also, or microbicides, and also rectal microbicides are also being talked about quite a bit.
And this, I mean, obviously it's not a cure, but it certainly is very exciting information. And what came out of the spermicides? Are there ones that are effective?
Well, there was a microbicide, a vaginal gel produced by a company called Indivus, and it's called Pro 2000. And they presented data showing that it was 30% effective. Now, 30% effective. If I was to attempt something and only have 30%, only be able to achieve a goal of 30%, I would consider that personal failure.
Yeah.
So I don't think 30% is so great. But from a different standpoint, it does show that microbicide is possible.
Sure.
Because it did have some effectiveness. Now, probably not with that particular product. So I wouldn't be waiting for that product, but I'd be looking for a better product. And actually, there was something presented at the conference looking at a microbicide that's a combination of two antivirals that are commonly used in everyday practice called Truvada. And so they presented data on, there was some data that was talked about during the conference, during the session completely on PrEP, talking about monkeys or MACs. And so during one situation where they tried to infect the MACs with the virus, they tried, after 20 attempts, none of the MACs became infective by using a microbicide, which is a Truvada type gel.
Wow.
So that kind of shows us that there is good possibilities.
So wait a minute. Now, this is Truvada, which is normally a pill that's taken. And what they're doing is they're putting it into a gel, and that gel is put on either inside the anus or on the anus, or? Well,
in this particular situation, in these MACs, this was, I believe, vaginally inserted. But the gels themselves, or this type of pre-exposure prophylaxis, the nice thing about the gels are they can be 100 times the concentration of what you would normally see in a pill. There are many, many, many more times the amount of drug getting to the target cells than a pill can do.
Right.
There's no systemic exposure to medication, so you don't need to have medication monitoring for liver abnormalities or kidney abnormalities.
Absolutely.
And so from that standpoint, it's tantalizing. On the other hand, obviously, if you're going to put a gel in your anus, hopefully it's going to be comfortable, and hopefully your partner will not get turned off from it, or hopefully it could be even disguised if you want to have that kind of situation.
Now, okay, obviously you beat me to the punchline question, but are they recommending to use these PrEPs in combination with condoms, or they're saying this is an alternative to?
Well, there is no existing microbicide, vaginal or rectal. It's in development. So there are a number of studies that are being launched now looking at these microbicides, as well as also possibly taking a pill for preventative. And so many of these studies are being conducted in Africa. There is a study that's actually being sponsored by the Gates Foundation and it's going to be done. It's called IPREX actually, and it's going to be I think about 3,000 MSM'S or men having sex with men, and it's going to be at 11 sites across 4 continents, and they're going to look at Truvada versus a placebo, and they're not only going to look at HIV prevention but also hepatitis B, because the Truvada medications, which is a combination of Viriad and Emtreva, are both effective against hepatitis B as well. So this is going to be a very exciting and very important study to watch, as well as the other studies that are being launched at current.
And for those who don't know, PEP is post-exposure prophylaxis, and this is like the day after pill, and so to speak, and that is already being used, right?
That's already being used. I think almost nearly every week at North Star, we have people coming in.
Every week?
Sometimes on a weekly basis, we can get a call that a patient thinks that they were exposed to HIV. In other words, someone that's having sex, maybe anonymous sex, or even sex with someone they know is HIV positive, and either the condom broke or they didn't intend to have the type of sex that end up occurring.
Sure.
And they're worried about exposure, and so individuals come into the clinic. If they come into the clinic within 72 hours, or they get in touch with us within 72 hours of the occurrence, we can put them on a cocktail of medications, and that cocktail halts HIV replication and hopefully prevents HIV from getting into the cells and causing eventual seroconversion. And the patients that do PEP have to be on the medications for 30 days.
And now, how effective is this? Is this like...
Well, we believe it's fairly effective. Of course, there's nothing that's 100%, but if it prevents 9 or 9.5 out of 10 infections in a situation where otherwise those individuals would be infected, that's a very powerful tool.